Welcome back, everybody, to another episode of Bread and Butter Primary Care. I'm Dr. Stokes, and today we're talking about type 2 diabetes, screening and diagnosis. So, two things in the video today to take out: when to screen, and then how to officially diagnose someone with type 2 diabetes. Screening. Before we talk about that real quick, always remember that when you're screening for something, that means you're checking for a disease process or a diagnosis without the presence of any symptoms. As soon as there's symptoms, as soon as the patient has complaints about something and you're checking because of a complaint, you're no longer screening. You're evaluating a chief complaint that might arrive to a diagnosis. Screening is when there's no complaints and you're just checking because there may be a risk of it happening. And so the first thing we're going to talk about today is who should be screened for diabetes. Type 2 diabetes, in a lot of cases, and these days actually in most cases, is an asymptomatic diagnosis. Oftentimes after people get diagnosed, they then realize that they had symptoms, but they weren't obvious enough to cause the patient to come in and complain about it. And one of the reasons why type 2 diabetes is being diagnosed asymptomatic is simply because we're checking in so many people. And so oftentimes when you're seeing patients on your rotations and you're having people who come in, there's always this question about, well, what lab should I do in this otherwise well patient? So how do you know if an otherwise well person without any complaints should be tested for diabetes or not? So that's our first question to answer tonight. So this is, and I want to have kind of a caveat on the conversation today because there's probably a difference between textbook screening for type 2 diabetes and what happens in the real world. And I like to talk about what happens in the real world, what actually goes on, because it's more pertinent, but I also want to make sure that we know what the actual textbook definition and the textbook answers per se are to this question. So as far as textbook answers, I like to put people who should be screened for diabetes in two different groups. One are people who have no other risk factors. And then the second group is people who do have risk factors. So if you have a person who has no risk factors, so they are not overweight, they don't have a family history, they haven't had any symptoms, nothing like that, they're a completely healthy, otherwise healthy person, they're coming in to see you, and should you check them for diabetes? The answer is yes, if they are over 45 years old. So that's the textbook answer. It's not technically recommended to screen someone for diabetes. Again, check for it even though there's no symptoms, unless they're over 45 years old. So most recommending bodies recommend 45 for screening. Again, that's no symptoms, no risk factors. Now, it's not all that common that we come across those patients in primary care, especially if you're in like an underserved primary care situation where like I practice, because most of the people who are coming have risk factors, especially with how prevalent obesity and overweight is. It's pretty rare that you have this perfectly healthy person in front of you wondering what should be done. But if that does happen, you don't need to check for diabetes unless they're 45. So group 2 for screening are people with risk factors. So oftentimes you need a combination of 2 risk factors, but you're going to find that it's very easy to get those. So overweight is one. So that's usually the first thing. If someone is overweight, a BMI above 24.9, which is very, very easy to meet. I think most of our patients are above that. So if they have a BMI of 25 or above and any other risk factor, and a sedentary lifestyle is a risk factor, poor diet is a risk factor, family history is a risk factor, having blood pressure, having high cholesterol. So pretty much an overweight person with any other risk factor, then you should check them. It's okay to check them for diabetes regardless of their age. Okay, so 2 groups of people to screen for diabetes. Again, testing them even though there's no symptoms, people above the age of 45, and any other person who is overweight and has one other risk factor. How often do we check? So let's say you have that perfectly healthy person, they're not overweight, they have no medical issues, and they're 46 years old. So you do screen them for diabetes and it's negative, you can check them every 3 to 5 years. If they have risk factors, then and it's negative, some say every 3 years, some say every 1 year, but you're going to check more often if there's risk factors involved. So that's who to screen. How do we screen? So what test should you use to screen? Currently, as far as recommendations, you can use any of 3 tests in order to screen someone for diabetes. An A1C, a fasting sugar, or a 2-hour glucose tolerance test. The 2-hour glucose tolerance test really isn't used very much. The only situation really where that's used a lot is in evaluation of pregnancy or in pregnant patients. And so that one I'm not going to talk too much about. So really you have fasting glucose and A1C. So if you have a person, they don't have any symptoms, but they are either above 45 or they're overweight with a risk factor, you can check for diabetes. You can do a fasting glucose and see if it's above 100, which would then lead to further testing, or you can do an A1C and see if it's above 6.5. And we'll talk a little bit more about those tests in the diagnosis section. So fasting sugar, A1C, over 45 if no risk factors, any age if they're overweight and have one risk factor. So that's who you want to screen, check for even though they don't have symptoms. So how about diagnosis? What are the criteria to diagnose someone with diabetes? Again, there's technically 4 different criteria that you can use to diagnose someone with diabetes. There's a fasting blood sugar, a random blood sugar with symptoms, the A1C, and the 2-hour glucose tolerance test. So those are 4 ways to diagnose someone. So these would be people who are coming in who have symptoms, have complaints, and so you're wondering if maybe their symptoms are from diabetes. You can do one of those 4. Again, the 2-hour fasting glucose tolerance test, very rarely done except in the pregnant population, so that one we're not going to talk so much about. So then there's the other 3. So you've got a fasting sugar, an A1C, and a random sugar. The fasting sugar, the magic number for fasting sugar for diabetes diagnosis is 126. So if you have a person in the office, you get a fasting BMP or fasting labs, and their sugar comes back above 126 and they hadn't eaten in the last 8 hours, that's diabetes. So that's a diagnosis above 126 fasting. As far as the A1C, 6.5. So an A1C of 6.5, that's when they have diabetes. So you draw an A1C and then you can know. A random sugar, there's 2 things that are required. It has to be above 200 with symptoms. Okay, so if you have an asymptomatic person and it's above 200, chances are that they have diabetes. They at least have some sort of glucose intolerance issue. But as far as a textbook definition, if you're going to diagnose diabetes off of a random glucose reading, it needs to be with symptoms and above 200. Fasting above 126, A1C above 6.5. Which one of those tests you use to test someone for diabetes really depends on your area of practice, insurance companies in the area, what's covered, and that type of a thing. As far as recommendations, any one of those 3 is suitable to diagnose someone with diabetes. The A1C is probably the easiest one to use because it doesn't have to be fasting. It gives you a 3-month idea of what the sugar's been like, and you don't run the risk of just like happening upon a low sugar when they actually have diabetes. You know you've got it if you do an A1C. And so I oftentimes, if I have someone that I'm checking, I'll start with a fasting sugar, and if that's high, then I'll repeat an A1C. But if insurance companies cover an A1C, if you know you're able to get it for without any extra cost to the patient, really getting an A1C is probably an easier and better way to go. So that's the video for today. Quick recap: screening for diabetes, who to test even if they don't have symptoms. People over the age of 45, anyone else if they're overweight and have one other risk factor. How do you diagnose diabetes? One of 3 ways: a fasting sugar above 126, an A1C above 6.5, a random sugar above 200 with symptoms. There's that glucose tolerance test that is technically another way to do it, but it's just not done very much, so I decided not to talk too much about that one. So there's your video today for Bread and Butter Primary Care, who to screen for diabetes. what numbers to use to diagnose it. Stay tuned for more videos, and I hope you guys have a great night.